I served in the Navy 23 years, 1 month, 9 days. I started out in boot camp in Orlando, 1976. Ended up on a ship in Norfolk, the Richard E. Byrd. Did 20 months there, and I changed ratings to data processing. From that point on, I went to some other ships, aircraft carrier, the Independence, also the L.Y. Spear, which was a nuclear subtender. And because my wife and I were having children, I had to make rank fast. So I made E7 in 8 years. And after that, I got commissioned. I made E8, but I took the commission to warrant officer. And from that point on, I worked in intelligence for the rest of my career. And I did overseas tours in London, Naples, Italy, Rota, Spain, and New Orleans. My last place was Rota, Spain, but I also served in Turkey and in Greece, Suda Creek. So I had a really great career. I ended up going to over 60 some countries, and I was able to take my family to a lot of those places. And so that's pretty much was my service. And I retired February 1st, 2000. Well, I started trying to get compensation when I first retired because I had high blood pressure and I had back problems from a back injury, and just really had no luck. The only thing that I was able to get prior to, I would say, 2018 or 2017 was the high blood pressure, which gave me like 20%. And I was having other issues too with my back and legs, and some things I didn't even know about. I think it was online. I saw something came in the email. Then I followed up and I talked to some other veterans who had used lawyers, use other companies. And, based on my discussions with other veterans and some family members who were veterans, I decided, okay, well, this is the route I need to go because I'm not getting anywhere on my own. It was a little rough at first because I had to understand the process and then all the evidence gathering. You have to be willing to help them help you. And then there were some other things, but this last thing, which was one I never foresaw, was the unemployability. I had to stop working, and I loved working. At first, I was full time, and then in 2023, I had some health issues, and I went to part time. But the issues persisted, and then I had another incident, December 27th. I ended up in the hospital. So it was that point I decided, even though I'm only working 4 or 5 hours a day, I need to just, you know, pack it in. So they they had me work on tinnitus, unemployability, headaches. I have a enlarged left aorta that had to be rechecked, back injuries. But the thing that I didn't get 100%. I'm still at 90, but I got bumped to 90% back during, I believe it was the summer. I mean, got bumped to 70. And after that, I found out later in March of this year that I was at 90%, which I was really surprised. And so I was trying to get to still 100. But 2 weeks ago, I got a notification that my unemployability got me the payment of person that has 100%, uh, which is $4,300 a month. But I'm still at 90%, and I didn't understand how that worked. But well, it made me feel great. But I thought in my mind I was at 100. But I thought it was great because it was unexpected. I was thinking, well, I've tried all these other things, and then they denied or deferred. They deferred the headaches. They denied the tinnitus, which I still have issues with. But I guess that's something I'll have to work on again. It's because you get denied the first time, you still need to try again.
Yeah.
So I'll try again. But it made me feel great. I mean, I trusted the system. And the other thing was they worked with me on the payments,
Mhm.
which was good. I was able to stretch my payments out to where I could afford to do it. And so, the increase in payments is definitely a help there. Well, first I would tell them it's a hard fight trying to do it yourself. You need people that are seasoned professionals who understand how the process works with the VA, how it works with the people that do the examinations, how VES works, how those things could be positives in your they have your best interest, even though you may disagree, because I certainly am one that is skeptical. Sometimes I think I know everything. I don't. Now I have a daughter who's at 80%. She just retired from the Navy, and I gave her some advice. She didn't want to take it at first, but now that she's changed her mind.